Good morning, everybody. I'm delighted to welcome you to this Shoosmiths Shared and Halved webinar, and thank you very much for taking the time to join us. In terms of introducing myself, I'm Paul Batchelor. I lead the social care team at Shoosmiths, corporate partner. I'm delighted to be joined with various members of my team today and the firm to be able to offer some support in these challenging times. Before I go into it and introduce the team, we thought it would be helpful to do an interesting poll, because a couple of the questions that have come out when people have put some helpful questions at the start of the webinar is, what are the main challenges being faced by the social care sector, or risks that are being faced by the social care sector? So we thought it would be useful, while I've made some introductions and do so. So on the right-hand side of your screen, there should be a poll popping up. Obviously, the answers are anonymous, but the poll is intended to ask what the biggest challenges are in the social care sector during this crisis. Now, we've pulled together some multiple choice answers, but I'll reveal those results once I've introduced the panel. So, Fran, if that poll could be kept going. And the delegates only get to get one answer, so choose wisely. So firstly, obviously the challenges faced by the coronavirus has affected everyone, and I've been particularly proud of our team, and also the social care network and the social care community which we work within. Everyone is obviously dealing with a lot of challenges, and we've been working with a lot of playbook for coronavirus. So we thought it would be helpful to the community and really sort of help collaborate together, but also address some of the questions people are having, and share firsthand our experiences that we've been experiencing with our clients. In terms of the panel, I'm delighted to be joined by Hayley Saunders, who's one of our regulatory partners and does a lot of work with healthcare providers, working with CQC and health and safety regulators.
Morning, everyone.
Charlie Rae, who is one of our employment partners, who as you could expect, has been working around the clock with many clients dealing with employment-related issues.
Good morning, everybody.
Catherine Williams, who is one of our real estate partners and head of our cross-divisional living sector.
Good morning.
And John Cleaveley, who's one of our developing healthcare projects.
Morning.
I'm also delighted to be joined on the phone by Greg Lapham, who's the former CEO of Precious Homes and Chief Operating Officer of CareTech, who I've known and worked with for many years, and to offer his own sort of operator's view on dealing through or navigating through the current crisis.
Morning, everybody.
Perfect. Before we reveal the results of the initial poll, if you do have any questions, then there's a chat function that makes sure it goes to everybody. We do have, and I'll mention it at the end, a coronavirus hub, which has got lots of really useful content and everything. And it goes without saying, if there's anything you want to discuss further, then do please get in touch following the call. We'll also be and key highlights to be able to do that. If people could, when they do dial in, put themselves on mute as well, just so that we don't hear things in the background, that will be fantastic. So before we kick off into the actual specific practice areas and different questions, Frank, could we close the poll and just see what the mood of the room is when it comes to the challenges being faced by the social care sector, and publish those results? Where our technical thing hopefully works.
Yeah, so I'm closing that now. It's counting down from 5.
Oh, right, okay. Eagerly getting through. So just to remind everyone who didn't dial in, the options that we had, and those people on the phone, the options on the multiple choice challenge in social care during the crisis, managing staff absences, recruitment of new qualified staff, cash flow, maintaining quality of care, minimising risk of future claims against the business, and developing or development project delay. We haven't actually been able to share them. I think you might have to click publish or share or something. But if that doesn't work, we can move on. Oh, maybe not. I can't see it. Well, we can come back to those when we actually when we can see them. We'll come back to those. So thank you very much for all of the really interesting and insightful questions that have been put to the panel as part of the registration process. It was really helpful to see different people's view and different awake at night. There are many of them at the moment. They've obviously been pulled into a number of different buckets, and really to try and get through as many things as possible within the hour and finish on time. We'll address them in those buckets. So there's, as you'd understand, employment staffing challenges that are created. There's regulatory issues. There are real estate and development issues. And then, of course, there are operator issues where we can sort of pose some interesting questions to Greg. I'm not saying that I won't call upon people in the other areas during each section, but say I'll focus on employment first. So, Charlie, there are a number of questions around furloughing staff, and interestingly, the social care sector is having a different challenge more than other sectors, rather than trying to get the majority of business, or a large proportion of businesses they've got the other end of the spectrum of actually trying to get more staff or more people and carers into the business as quickly as possible. However, clearly there are furlough arrangements and not incentives, that's the wrong word, but initiatives by the government to help businesses, which all businesses should be considering. So firstly, Charlie, I think it would be useful for the group to actually very quickly explain what furlough is. And there were some other questions which came through, such as, can employees who have been furloughed from another sector or business work actually work in the care sector supporting staff shortages? So if you have lots of people in retail, can they go into care and actually plug the staffing, the gap, as an example? And another interesting furlough because they or a family member are in a vulnerable category or isolating.
Sure. Well, morning, everybody. And kicking off with answering the question about these new furlough arrangements, it's right to say it's a word that I'd never really used at all until a couple of weeks ago, and maybe like Brexit, it's become word of the week or word of the month. It's actually a term that originates from the US, so those of you who have US connections might have heard of it a bit more, but it really doesn't have any legal meaning in the UK employment law at all at the moment, albeit it's being used to describe the government's job retention scheme, and that's a scheme that many of you will have no doubt become a bit familiar with the terms of it, whereby the government are offering a grant to employers of up to 80% of employees' usual wage costs, including employer national insurance contributions and pension minimum contributions. So it's a little bit more than the 2,500 cap, potentially, for all of those employees who are furloughed, which I'll describe in a moment. But certainly when the scheme was introduced, it was being aimed at seeking to avoid the possibility of employees being made redundant or laid off from work. But actually, the requirement, I've been asked this a few times, do you have to prove that then you would be making that employee redundant or laying them off work? Well, it seems not, no. The guidance doesn't actually require that. And all that it sets out in the employer's guidance is that it's aimed at employers whose operations have been severely affected by coronavirus. So it doesn't appear that employers are going to have to present any kind of claim with proof that they meet that threshold, but HMRC have said that after this is all over, that they reserve the right to go back and check employers' claims were properly made. I think what that means in practice is that businesses were affected by coronavirus. For example, if you're a hand sanitizer manufacturer or a supermarket, I'm sure that if you were then trying to claim under the furlough scheme, you might have some difficulties in showing that your operations had been severely affected. But that's what the scheme is aimed at. You can furlough employees for at least a 3-week period, so you need to have a 3-week period to be able to claim the subsidy back from the government. An employee who's to be furloughed needs to be notified of that fact. One thing that's come up a lot is that you may well be amending someone's contract of employment if you're furloughing them. And strictly speaking, it says this on the government website, and it's a matter of employment or fact, is that if you're changing terms and conditions, you ought to be agreeing that with staff. That, in a sense, is a whole other area, but that's just a point that's come up quite a bit as one of the headline employment issues. Does one try and get express agreement versus simply impose a difference in approach to some businesses? Some of the bigger businesses have simply told employees they're on furlough and then are relying on the fact that employees will agree it by inference. But the rules require that once an employee is notified that they're furloughed, they can't do any work for the employer. They need to be furloughed for at least 3 weeks. And they need to have started their job from the 28th of February. So anybody that was not employed by 28th of February, and new starters in March, can't be furloughed and take advantage of the government scheme. It applies to all employers, so private sector employers, public sector employers, albeit not many are expected to need to furlough staff, charities, and it applies to all employees as well, so those who are full-time, part-time, on 0-hours contracts. So it's a very wide-ranging scheme. There's been a huge take-up, as you might imagine, by employers. We're spending a lot of time. There are still a lot of unclear questions, though. So a lot of points that clients are raising with us where we still don't know the answers for certain. We're told, so I look out for it, those of you who have a particular interest in this, that there is further government guidance coming out today, we believe. We hope that will answer some of the tricky questions like holiday accrual, maternity leave rights during furlough. So that's in a nutshell what the furlough scheme concerns. One could probably talk about it for a lot longer, but I've really just given you the key headlines there. The government website for claiming isn't yet open, but we're expecting it this month. So employers have to pay the employees, then claim back the grant from the government. Paul, did you want me to proceed with the other questions that I know have been asked, or how would you like to?
Yes, please, Charlie. I mean, there was a particular question that was related to can you select, so when you're selecting business because they are self-isolating or they can't come into business because of a vulnerable family member or themselves being vulnerable, is that a reason that they can be put on furlough?
So I think the rules around furlough appear to be that if someone's on sick leave, it doesn't seem they can be put on furlough. So a lot of employees who are unable to work because of coronavirus may well be declaring themselves as absent on sick leave. And many of you will have seen that the government altered the rules around the claiming of statutory sick pay so that it became a day one claiming right, whereas usually there's a waiting period for statutory sick pay. So they've made a temporary alteration to the rules. They've also made it clear that someone who has been told they need to self-isolate because of coronavirus concerns can also classify themselves as sick for the purposes of the statutory sick pay rules, as in they might not actually have the symptoms, but they are told that. In terms of selecting, well, I think what needs to be noted is that an employee is on sick leave. They probably can't be furloughed is the current thinking. The government guidance suggests that someone who is on sick leave, you need to wait until they cease to be on sick leave before deciding to place them on this furlough leave. But when it comes to the question of then deciding, well, who should go on furlough leave, I think the main thing to be mindful of is the possibility of discrimination claims being brought against employers if the reason they give is potentially for some protected characteristic reasons. So I think employers will maybe want to tread a little carefully if they're picking out and potentially placing employees without their agreement onto furlough leave where the reasons are potentially their own health related or related to the health of a close family member, if there's a possibility of arguing associative disability discrimination. I think that what some employers are furloughing, and those who have come forward have sometimes said, I think furloughing would work for me because I have childcare responsibilities, caring responsibilities at home. And then if that person is then given the opportunity to go on furlough, having volunteered to do so, when that's the reason for it, then you're not going to find yourself facing a discrimination claim from that person if they put themselves forward. I think the challenge is where you are picking people out who aren't on sick leave, who can't be furloughed, but then the reason you're picking them is for some reason that they might say, hey, that's discriminating against me for a protected characteristic. So a lot depends on the approach employers are taking. I think getting agreement and seeking volunteers is unlikely to lead to then those who are furloughed because of those reasons claim discrimination.
Excellent. And I think another point which is very pertinent to the social care sector, probably slightly more pertinent, is employee liability, but employee liability and really what the employer obligations are to those with coronavirus or exposed to coronavirus, and also then if an employee contracts it and then states it was a result of being a key worker working in social care, that they'll be able to claim against the organisation as a result of that. So I suppose just addressing that first point, it's sort of flipping over to Hayley on the regulatory side, really. So what do you think the employer obligations are to those with coronavirus?
Yeah, I mean, it's a tricky one, and as we said, we're in this uncharted territory of knowing what to do in these present times. But from a legal perspective, obviously the Health and Safety at Work Act, all of the regulations that sit around health and social care remain in force. They haven't been relaxed. There has been some that the HSE and the CQC are going to take in relation to enforce them, which I'll probably cover a bit later in my section. But generally, in terms of health and safety obligations, they are there and they remain. So employers have got to do what they can to comply. So obviously anybody that's ill with the virus must be at home self-isolating. Those that are not displaying any symptoms, and in relation to the health and social care sector, there is obviously this expectation that they will be on the front line working because that is their job and they simply can't do it from home. The answer has got to be, employers have got to do the best they can to follow all of the government guidance, which I fully appreciate is so difficult in relation to social distancing and cases where workers are on the front line dealing with individual patients. So it's applying the principles that come from those guidance documents that the government has issued and the CQC and the HSE in relation. Much a legal point, but in terms of communicating how the business is complying with those guidance documents to employees, I think is important. And I certainly don't profess to know anything about employment law, and Charlie will correct me here, but what we will probably see is where the communication has been poor with employees from employers, and employees will think that employers are perhaps not following the guidance in the way that they should be following. And then there may be whistleblowing issues, not necessarily always to the employer, but perhaps even worse, going to the media or social media, where they say, this is my organisation, they're making me stand, 30 centimetres next to Joe Blogs when I don't think I need to. That's the type of damage that employers may suffer. Yeah. And perhaps it won't be as relevant in the health and social care sector because those that work in that industry know that they are in close contact with individuals. But I would say communicating everything that the company is doing as best you can with your employees will help hopefully mitigate any of those issues. You can comply with the guidance, fully appreciating that it's not always going to be possible in these times.
And I think one of the things that we're experiencing with all clients that we're revising through this, and I mentioned it earlier, is that there isn't a right or wrong answer at the moment. There isn't a playbook or precedent for where we are. So actually doing the right thing, documenting it and making sure that you can justify the decisions taken is probably the safest option.
Yeah.
It's not that you won't get in trouble or there won't be an issue, but actually doing the right thing within the spirit of the guidance, I think, is important.
Certainly, and just being really mindful on that point that, again, a classic from the HSC, if there's ever a prosecution, is this allegation of putting profit before safety.
Indeed, yeah.
The decisions that are made, making sure that they're not, and I'm not suggesting they are, but they're not made for financial reasons.
Yeah. And I think one eye on time. I think the last point, Charlie, which is something that isn't potentially could be causing some anxiety within the sector, is whether or not this issue will in some way delay or frustrate the ruling in sleepings, or the Supreme Court coming back on that, which I know we're sort of due a response from. So, do you have? I mean, to the extent we don't have a view or anything like that, but do you have any sort of idea or thoughts on that?
Yeah, I mean, we don't have a date as to when. We never did have a date as to when the judgment would be delivered from the Supreme Court. It was heard in February. We know that the Supreme Court isn't sitting at the moment, and what they have said, because we've called them to ask them about what's happening with the decisions, and particularly the MENCAP decision, is that they say that judgments are still being delivered in the usual way. So what usually happens with the Supreme Court is that on the Friday, a list comes out as to the decisions that are going to be delivered. They have delayed that today until next week. So I think the short answer is that the Supreme Court judges are still probably going to be working on the decision.
Yeah.
And that we shouldn't expect that it's going to be particularly delayed because of coronavirus. There does appear to be a general delay in the court system, but I think the usual. It's not particularly knocked the time frame. It's as much as we know at the moment.
Right. Okay. I have the results up in front of me relating to the poll that we ran earlier about what the biggest challenges in social care crisis are, and unsurprisingly, the front runners are managing staff absences is out in front, and almost alongside that is maintaining quality of care. And there's a couple of cash flow bits there. Interestingly, no one is particularly in recruitment or of new qualified staff being the main challenge, or development projects or anything delay. But that was useful to see that. Moving on to the next session, we'll move on to talk about some regulatory questions that have come in and speak to Hayley. So, Charlie, stay online, Charlie, because we'll come back to you if we have any questions. In the meantime, what I'd like to do is run another poll, which we're there, and we'll reveal the results at the end. Which is going to be an interesting one, is on a scale of 1 to 10, where 1 is very poorly and 10 is excellently, how well do you think the government is supporting the social care sector during the crisis? So those who are on the WebEx and can do that, it'll be interesting to see where that comes out at the end. So, Hayley, moving on to questions, and so you already touched upon a couple earlier. One that is coming out that's discussed with clients as well during this crisis is whether or not CQC has effectively condoned care staff operating on a skeleton staff or dropping standards by suspending routine inspections. What's your view on that?
Well, wouldn't that be nice if the regulator took its foot off the pedal? I'm afraid not. I mean, obviously the CQC and the HSC hasn't specifically said that it condones care home operators operating on skeleton staff, and obviously it's not going to. The reason it's suspended its routine operations and its routine inspections at the moment is simply to protect its own workforce from having to access and visit care homes or supported living providers. Their primary stance will obviously be the regulations are the regulations, as we said earlier, and companies and employers need to do their best to fight. QC has said is that it recognises the current crisis and they'll apply a flexible and proportionate approach to the risks and the challenges that companies are facing at the moment in relation to this pandemic. they're obviously going to consider the burden that's been placed on employers at the moment from coronavirus, and they'll apply a risk-based methodology in order to try and deal with that. If something serious or untoward happens, they will obviously still investigate it. The extent to whether they can do that remotely or whether they have to visit premises in order to do that is obviously going to be dependent on the particular circumstances. But, you know, the law and the regulations have not been relaxed. Their approach to enforcement, you could say, has been relaxed slightly in that they're approaching everything with a flexible and proportionate response, which arguably they should do in every case. But it's going to be based on a risk-based methodology in relation to coronavirus. They can understand the challenges, especially this sector. And what
to Greg for this one of his questions is actually linked to that, is how you can look to ensure that the standards of care remotely are due to, or rather, how you can actually confirm that your the standards are kept when you can't necessarily visit every service and actually go around the country, which I know you would normally do.
Thank you, Paul. Obviously, a lot more difficult. From what I know, most managers are still going into work, deputy managers, to run their services. So from a quality perspective, you've obviously got managers in place in most cases. A lot of operators run electronic systems within their organizations, so things like care planning, daily notes, incidents and accidents, programs, and that obviously allows a lot of remote monitoring of what's happening in those services. I think the biggest impact in terms of the quality of what's happening in the service is going to be the shortage of staff, and everybody within the care sector is obviously struggling because of coronavirus. So yeah, I think it's boots on the ground is the main issue, and everybody who is going to work is doing their utmost. I'm part of a number of groups, and I've seen some brilliant videos of things happening out in the community, but you can definitely see a slight shortage of staff, and naturally people are concerned because of the close proximity everybody is going to be in working together.
Yep. And I think it's noticeable, so the use of and actually remote monitoring, and also you'd be able to use video chats. I mean, we've all been forced into in a good way using these things because it'll only sort of improve communication. But it'll be interesting to see, probably once the dust settles, whether or not you can sufficiently review a service not being boots on the ground.
Oh, absolutely. There is definitely an ability to walk into a service and to sense and to feel what is happening in that service. And, you know, a lot of people will make their minds up as to whether it's a good quality service or not within the first 15 seconds of walking through the door. And obviously CQC continue to do a lot of desktop work, gathering information. But the ultimate test in most cases is going into the service so they're able to experience that same feeling and to ask questions.
Those later on. So, but back to Hayley, a couple of other questions which relates to PPE, which is obviously a hot topic at the moment, and we're hearing different things. Some clients saying that they've got plenty of access to PPE, and others saying that they're struggling. So, I suppose putting to one side the availability of things, which hopefully the government is addressing. I suppose what liability exists if to the organisation, to the company, if they can't secure enough PPE, and I suppose linked to that, if there was a serious incident arising or someone contracting COVID as a result of a failure to have PPE, what risks are presented to the business then?
Yeah, I mean, the availability of PPE is obviously a really thorny issue at the moment. Anybody who saw Question Time last night would have seen sufficient PPE, and then the Chief Exec of the Royal College of Nursing saying something different. So I don't obviously have a full grasp in terms of the practicalities, in terms of where certain clients or certain organisations are able to obtain PPE and others that are not. And having spoken with Greg, and Greg, feel free to jump in, I think we discussed yesterday that some do have an abundance of it. And if you know of other organisations, perhaps at a local level, that do have sufficient stock, then get in touch with them to share that around, so that when stocks are replenished, you can then share it amongst those that work in the local area. Again, I'm sure everybody on this call is aware of the specific hotline that's been set up and the numbers on the CQC website in terms of the health and social sector that needs PPE, and there's a dedicated line that they can contact to obtain supplies. But back to the question, in terms of legal liability, as with any question in relation to legal liability, there's always two strands. So there's the criminal aspect and then there's the civil aspect. Obviously, any enforcement would be by the HSE or the CQC, dependent on whether it's a member of staff that's been injured or it's a service user. And when I say injured, in terms of any, contracting of the disease, of the virus. Again, going back to the point I mentioned earlier, the approach that's going to be taken by the HSE and CQC will appreciate the risks that the sector faces at the moment and the challenges that it faces. So, again, it goes back to, obviously, you need to obtain PPE and you need to do the best that you can to obtain that PPE. It's very, very difficult to provide frontline services without it, but understandably, people, and I'm sure the support workers, are going to put the care of those that they look after probably above their own, which is obviously what we're seeing with the NHS as well. But from a criminal perspective, again, it's being able to document that you have done all that you can to ensure that you've obtained that PPE. And I appreciate the difficult times that we all face, but it's going to take in relation to their proportionate and reasonable approach to the risk. So I would think it's unlikely that organisations who quite rightly face this challenge at the moment in relation to PPE would then find themselves on the receiving end of enforcement action from a criminal perspective. Again, it's always going to be fact specific. If you haven't done enough to obtain that PPE and there's any sniff of profit before safety, then that's clearly going to be an issue that could be investigated. In relation to civil liability, any claim that's brought by the injured person, again, and the injured person that contracts the virus would be, I would have thought, under the PPE regulations. Those regulations that I'm sure everybody on this call will be familiar with, which places the obligation and the burden on the employer to use PPE to protect its staff. Or other adequate controls.
I think what is interesting, an interesting point with that is, and before protection is, lots of organisations will be having to spend far more than they're expecting to budget on PPE. And I suppose, Greg, what's your view on whether or not those would organisations would have an opportunity to go back to a local authority and say, look, we had to spend lots of money on additional PPE?
I think there is obviously that opportunity, Paul. I would expect not a lot of operators to do that. And the reason being is we all have spoken about how short everybody is on staff. And I think the last thing we want the local authorities and CCGs to be doing is turning around and saying, well, okay, what's the bill for the additional PPE? And by the way, did you prove to me that you ran the correct level of staffing in all of your services over this period of 2 months, which struggled to prove that they were adequately staffed or staffed in accordance with their contractual obligation? And the last thing I think we want to see is providers having fees reduced for over this period. So I don't think many organisations will be putting their heads above the parapet. Personally, I wouldn't be doing so.
And it's an interesting point in that when we come out of this, there will clearly be public budgetary pressures, and I think you can be very sure that people will look back on things to try and recoup costs from what's happened in order to balance their own books afterwards. So there needs to be careful that there will be scrutiny on what people do, and as you say, the amount of costs or expected staffing levels, and then potentially a reconciliation between those afterwards.
Yeah, absolutely.
we've not touched upon all of the regulatory questions, but one eye on time to trying to make sure we canter through things. So we'll pick up some of the things. In particular, there was a question around the Care Act amendments. Have they been brought in? But we'll pick that up in the following in the highlights note. Turning our attention to real estate and development projects, we know that a number of clients that we work with and organisations, operators or specific developers will have projects in process. They won't be operational yet. And really, this is going to paralyse or delay those things. So I suppose I'd pass to Catherine Williams to start with, and on a couple of points arising. Before we actually talk about development projects, there was a really interesting question that was raised around house moves, and one of them was whether or not we can house moves and how we believe that they should apply to adult social care, in particular in a supported living context.
Yeah, this one's been on the news a lot, obviously, because the housing market is a real bellwether of the economy. But basically, in terms of social renters, there is actually no prohibition on house moves. There is a strong recommendation in the guidance that people try to avoid moving house at this time, in line with the social distancing regulations. So the advice really is, where possible, delay. But obviously there are going to be some people who are either coming out of hospital or have to move, and they still can move. So our recommendation would just be to put very clear evidence in place that you've considered the social distancing guidelines, that you have given guidance to the removals company if there's a removals company involved, and all of the residents in the home if you're moving to residents in the house, that everybody just keeps their distance. And that's really all you can do in line with the guidance. It's a bit of a tough one, obviously. It's in the papers all of the time because of the impact on mortgages and sales, but pretty much anybody can still move if they absolutely have to.
And I think with all these things, it's actually balancing the right decision when you've got employees, you've got service users, you've got the law, it's about being able to package those together in this time to come up with.
I think it's just about
the right decision,
taking a pragmatic approach.
Yeah, exactly. And in terms of the point I touched upon earlier about the development projects, there'll be a number with a shortage of beds. Obviously, it's important to get those beds online, but they will be delayed or grinding to a halt. What's your view on sort of in-flight projects and generally people who are developing their own services?
There's a chronic bed shortage across the sector, and that's not going to change. So it really does depend on what stage of your project you're at. So anecdotally, I have sold 3 development sites with planning permission in the last week. That shows that operators are in the market, still their pipeline to be committed for the next few years. There's no point in this period in stopping your pipeline, because you're only going to push those chronic bed shortages down the line. So you obviously have to manage that with all of the other projects that you have in the pipeline where you may be on site. And that's where John comes in. And a lot of queries at the moment from developers, contractors, all concerned about whether the pandemic is full or if it is going to result in an extension of time, what's risk is in terms of liquidated damages. And over with contractors and developers about how you can mitigate those risks as you can.
Yeah.
And advice you can give to John.
Thanks, Catherine. I think if anybody had any doubts about the construction industry being fragmented, I think the last couple of weeks have probably.
Yeah, we can hear you, John.
Can you hear me? Yeah. Yep. The last couple of weeks have thrown into fairly sharp focus that really is totally uncoordinated, and there's a general mess across the whole industry. I think if you're developing in the social care sector, or if you're an operator and you're waiting for your developer to come on board with your new scheme, the the things you're going to need to be asking are around what are contractors doing, understand is doing in relation to carrying out work or not carrying out work. The government's made it very clear that construction sites should remain open where it's possible to comply with the PHE guidelines on working safely. But a lot of contractors have unilaterally decided to shut their sites. Some have shut and reopened. Some have decided to shut down almost indefinitely. A lot of the supply chain is quite animated at the moment around whether they're being quote unquote forced to go to site to work on projects, and some again have refused to attend sites. And there's also been a lot of press around builders merchants and provision of supplies, where a number of builders merchants closed down and then were requested by the government to reopen, and they have done to a certain extent. Mm-hmm. So all of that puts the contractors in inquiry on, do they stop? If they stop, can they put claims in? Some contractors are trying to persuade their clients to instruct them to stop work, which benefits the contractor more than the developer, because the contractor can then claim its costs associated with the stoppage, as well as an extension of time. Mm-hmm. And then from a sort of a developer operator perspective, there's a debate going on obviously between the developer and the contractor about are the proper grounds for an extension of time. As Catherine mentioned, a lot of contractors are referring to force majeure in their contracts, which is essentially an event that's beyond their reasonable control. Mm-hmm. And a lot of developers are firing back at the moment and saying, well, what do you mean that this isn't beyond your reasonable control? Can you advise us how you can't comply with the guidelines? Please advise us why you can't get labour. So there's quite a debate going on at the moment. And then obviously between drafted differently, some will be back to back with the building contracts. Some may have a tighter definition of force majeure. So need to be looking at those documents as well and understanding how any delay on site affects the contracts that apply off site. Yeah. As well. Practically, and just finally, what seems to be happening after quite a lot of fencing, developers and contractors are kind of getting to an agreement whereby they will agree, where the sites have been closed, they will agree that they can remain closed for a period of weeks, not months. Mm-hmm. And on that basis, the contractor will not claim additional cost. And the developer will not claim its delay damages, and that seems to be a sort of pragmatic way that a lot of these things are being resolved.
And I think you're right, and so Greg will have a view, having done a number of projects developing new services. I suppose, Greg, everyone involved to come to a pragmatic solution, including funders, including local authorities, because there will be challenges that everyone's facing, and that's I suppose the good thing about this, it's affecting everyone. So, and no one can really be pointing fingers to say, well, why didn't you do this? Because actually, no one really saw this coming.
No, absolutely, Paul. I mean, I think first and foremost, it's in everybody's best interest for that project to complete, isn't it?
Yeah.
So I think it's a case of getting all stakeholders to sign up to that ethos. We need to complete this project together, and let's work together during this difficult time. There's no point in falling out, because obviously there's going to be a lot of that falling out, I think. Yeah. And there's going to be a shortage of builders on the other end of coronavirus. So, projects could be delayed a lot longer if there's a falling out between parties during this period.
It's really, really important that we don't let the construction industry fail. As John and I were talking about yesterday, it's just such a huge employer in the country. So we don't want developers tipping contractors over the edge for the future of our economy.
Oh, absolutely, completely agree. I think there's 2.5 million odd people employed in the construction industry.
Yeah. Okay. Well, that's a really interesting view on things, and actually just the other areas that we don't necessarily be thinking that will be impacting the coronavirus, and also just general business as we try and navigate through. I'd like to thank you very much, Catherine and John. I think I'd like to just pass over to Greg on for a few things. Luckily, we picked up quite a few of the questions that have been arising during the other sessions, but there are some interesting points arising. One point is the crisis that we're having to navigate through, and everyone's looking at their own business, and I think everyone will come out of this with lessons learned, but someone said necessity being the mother of invention. There are lots of new equipment and software being developed for clinicians and care providers. So how do you see the delivery of social care changing, if at all, after the crisis is over?
I think there's just inevitably going to be quite a few changes, Paul. I think, firstly, you've got two buckets, if you like, of care companies. You've got care companies who've embraced a lot of technology and have got a lot of electronic monitoring systems in place. They're obviously really going to be able to test the effectiveness of those systems, and undoubtedly there will be a couple of shortfalls or areas where they hadn't thought about, where they're going to be seeking software to plug the gaps. And then you're going to have the other groups on people visiting services and sending Excel spreadsheets, payroll with lists of employees and the hours. And obviously they're going to be feeling the impact of this current situation where they're under-resourced in terms of manpower or people power. And they're going to be looking at investing in systems so that they don't experience what they're currently experiencing. And then I think you've got software developers who are going to be talking to operators and going to be going, how can we take forward some of the things that are being done within the services, like, service improvement plans? How can we put that onto a better platform so that there's better visibility and flagged reminders and things like that? So, I think it's going to result in a lot more innovation. And it's, I think people are probably having a lot of great ideas as we speak in terms of, we could do this.
Indeed. I mean, especially sort of topic at the moment in sort of Meditech, because you kind of feel like we've got the technology to be able to say check people's vital signs, check they're alive, check all those things, which are a large proportion of sort of home care in particular. But it'd be interesting to see whether or not those things really take off as a result of this.
Yeah, it will be very interesting.
Do you think another question that was raised was whether or not we think that local authorities or CCGs will in any way be delayed just because of their own back office staff not necessarily being there, or payments being delayed that could cause as a result of the crisis? And I suppose linking into the point earlier, whether or not we feel like this is going to, how this will affect the ability to get proper fees secured for the appropriate care provision.
Interesting question, Paul. I think there's a couple of answers to currently supporting in your services. Now, most local authorities and CCGs run auto payment runs. So once the fee's been agreed, for argument's sake, £1,000 a week, it's put onto the system and it is paid on a regular 4-weekly basis, or whatever that local authority or CCG's timing is. And those payments are just made regardless of your invoice going in to that particular CCG. So you've got those auto payments that are happening, and I've spoken to some people prior to today's call, and those payments are still happening. Where you've got the second group of people is where somebody who's recently moved into the service, where they need to be set up on the system. I think that's where there are going to be a lot more delays, because not everybody's working at their offices and has full access to systems at the local authority and TCG. So new service users moving in, system for payments. So, yeah, I think normally it is a slow process getting new people onto the payment system. I've experienced 3, 4 months, 5 months in some cases before the money starts flowing through. So this is just going to add a further backlog to what was happening historically.
And I suppose my last question for you, as we sort of draw to a close, the interesting part, when there is strain on, there's inevitable strain on the NHS and hospitals and discharge of people, how do you feel that admission of service users into the hospital environment, is there any resistance to that because they are already in a care environment? And do you think that, I mean, obviously we don't know, but is there potential for an overflow when there is no capacity in hospitals?
Interesting questions, Paul. I think the first question, admissions into hospital. I'm fortunate enough, my wife's a paramedic, so I've got first-hand knowledge of what's going on in some of our trusts. A lot of the hospitals have been able to empty beds and send people home, and some of those people have been in receipt of dom care services to help them at home. So we've had a large amount of beds being freed up within our hospitals, and we've got specific coronavirus wards, and the hospital staff are ready and waiting for people who exhibit coronavirus symptoms. The second thing about care homes potentially being used with coronavirus, I don't know, it's a possibility. I mean, I hope it doesn't get that bad. We've obviously got a number of hospitals that have opened up, new hospitals, temporary hospitals, the Nightingale Hospital. Mm-hmm. Yeah, I mean, we're just going to have to play it by ear and see. I know there's been quite a bit on social media. I'm not sure if people who are on the webinar have seen it themselves, but there's been quite a few letters being sent from local authorities, doctor surgeries to local care homes, asking people to update care plans and put DNR in place, especially in elderly care homes. Some learning disability services have received such communication as well. I don't think there's a lot of joined-up thinking being done around that. And obviously, you know, for somebody to be writing a letter to a care facility and saying, please, can you, where possible, revise support consultation, is taking a step too far, in my opinion.
Indeed. Well, just drawing to a close. Thank you, everyone, for joining the call. We do have the results, which of the poll that we ran earlier, relating to whether or not we think the government is providing enough support to the social care sector, where 1 is very badly and 10 is excellently. There's an interesting spread. There's some at the lower end. Majority are in the middle, towards the end, towards the top, which is an interesting assessment there. So, firstly, thank you to all of our panel: Hayley Saunders from Regulatory, Catherine Williams from Real Estate, John Cleaveley from Construction. Thank you to Greg Lapham for providing his operator's view on things. We will follow up this webinar with a link to the recording of this in a few days, which please feel free to share. We want to share it as wide as possible with your team or anyone. And also some highlights arising out of the discussion. We also have direct to the Coronavirus Hub on our website. But please do not hesitate to get in touch if you have any queries or you want to discuss anything further. But thank you very much for your time, and have a good day.